Talk more about this with our dietitian, Linda York. She's here from UConn Health Center with some advice, and we need some tips as well. Good morning to you.
Good morning, and I'm really glad I'm talking about this. Prediabetes is not talked about a lot.
No, we hear about diabetes, but...
Diabetes, type 2 diabetes, if we have prediabetes, we need to lose weight, and if we lose weight, that can prevent us from getting diabetes. So it's very important to lose some weight, even if it's 10 pounds. It can really affect you getting diabetes. Yes, your outcome.
Because I think a lot of people would say, this isn't in my family. I don't think I have to worry about this, but it sounds like we all kind of have to worry about this.
But it's very important, yes. And so we've done classes at UConn for prediabetes. You're going to hear more and more about it. And I just prepared some meals that are low fat, low calorie, based on the plate method, which I always believe in, which is half of the plate being the vegetables or fruits or both, a quarter of the plate being a lean meat, fish, chicken, lobster, whatever, and then a quarter of the plate, or like a fist, being your starch or 2 slices of bread. With that, we really have to limit our fats, because fats are the most dense. And these are healthy fats even we have to limit if we're overweight. And I'm seeing this trend.
Oh, avocados, they're good for you.
They are good for your heart, but they're very high in fat, thus high in calories. Same thing with nuts, about 1,000 calories in a lot of nuts, a cup of nuts. Olive oil, 45 calories in a teaspoon. So we really have to watch that. I have 2 breakfasts here that would be good according to the plate. Say you want 2 eggs, or you want 2 egg whites, because we probably shouldn't have eggs every day, although they're relatively low in fat. And then we have the bread, and then we have the fruit, which is at half the plate, fruit or vegetables. Here I've put blueberries, and then I Fiber One cereal, your highest fiber cereal, will really make you feel full, and then skim milk. And some people like to use, instead of the milk, they used to like to use the Chobani yogurt, which is wonderful. Lots of protein.
Do you think sometimes with this, as we look at these meals, we get this wrong? We put the meat or the pasta or whatever here?
I think traditionally that's what everyone did. That's what people, but I like these because you can buy them, and we have to now teach ourselves to put the vegetables and fruits here. If we do that at lunch and dinner, we're apt to change our behaviors accordingly. I made these fish tacos, and the recipe I have, and all lean, Mexican, pico de gallo, all lean. There's no fat in it, and they're absolutely delicious. So here is on the plate. We've taken the carb as the taco, and then we have all the vegetables in there, and then we have the lean fish.
In our last 30 seconds, I want to make sure we squeeze this in.
Oh yes, this is the peach salsa on a grilled chicken. These grilled chicken is wonderful to grill in here. Half the plate veggies, and then maybe some fingerling potatoes. And I made the brownies with applesauce. Took out all the fat, just put instead of oil.
The applesauce was cooked in there?
Yes. Just applesauce, didn't use any oil at all.
Wow.
So it's denser, but still chocolate. This is just your crisp, just made with baked blueberries and cinnamon and oatmeal, and you bake it for an hour at 325. And don't forget about Jell-O with non-fat Cool Whip.
This is like
about that. And so these are good desserts as well. So
you've given us lots to think about, and this all looks delicious too. Who says you can't eat healthfully and still have some taste?
Exactly.
Thank you so much, Linda. We appreciate it.